Hello and welcome. My name is Dr. Andi-Jean Miro. I'm a dentist focusing on cosmetic dentistry at the Appa Rosenthal Group in New York City. I'm a New Yorker in every sense of the word. I was born in Staten Island, raised in Brooklyn, and now I practice and live in New York City. I'm a former graduate of New York University College of Dentistry. While at NYU, I met several mentors who helped guide me and introduce me to the American Academy of Cosmetic Dentistry. New York University is one of the only schools that has an undergraduate honors program in aesthetic dentistry. Under the guidance of Dr. John Calamia, I became closely involved with the AACD. While I was an undergraduate, I wrote and published an article for the Journal of Cosmetic Dentistry. It was through this experience that I began to understand the importance of dental photography. Being able to document a case from start to finish, utilizing high-quality dental photographs is key, not only to creating beautiful smiles, but documenting and learning along the way. I've always had a passion for photography. I sometimes joke that my cameras are like my children because each one of them is special to me. I've experimented with a variety of dental setups for photography. A good friend of mine once said, "Andy, it's not the arrow, it's the archer." Meaning you can have any dental setup as long as your photos are consistent and constant lighting and focus parameters, you will be able to showcase the dentistry in the highest manner. There are many cameras on the market today, as well as many companies that cater specifically to dentists when it comes to selecting cameras and accessories. A DSLR camera has become the gold standard for taking photographs in the dental field. A DSLR stands for a digital single lens reflex camera. A digital single lens reflex camera is a digital camera that combines the optics and mechanics of a single lens reflex camera with a digital image sensor, as opposed to regular photographic film. What varies from camera to camera and can make one more or less expensive is the sensor internally. In order to take repeatable photographs with accurate lighting, we need two accessories for our camera: a fixed macro lens and a light flash system. When first diving into dental photography, I always say it's preferable to invest heavily in your lens first. Buying a high-quality lens that you can use as you upgrade your camera body is key to investing in a long-term good dental setup. The next thing we want to invest in is a light source. A light source is the second most important investment. There are a variety of light sources as well as light positioners and bouncers on the market today. Depending on the type of dentistry you hope to capture, the type of light source may vary. If your practice is more surgery-based, you may want to consider having a ring flash. If your practice is more cosmetic-based, where you do a lot of shade mapping, having a dual or twin flash option is preferable, because it will allow you to position the light more laterally, allowing for the camera to capture more information, light scatter, texture, depth of shade, and translucency. I hope to take you through some tips about camera setups and accessory options. Today we will talk about the ideal camera settings, as well as important photos that you want to capture prior to starting any treatment. I hope to take you through step-by-step on how to obtain the best images and some mini pearls, tips and tricks to perfecting your clinical photography.